SJ. Welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. Joining us for our program, and we wanted to talk to you about some of the efforts that your organization has been doing to coordinate some of the activities that tribes are dealing with in the COVID-19 crisis right now. So, good morning, Mr. Barton.
Good morning, Gary.
Now, first of all, for people who aren't familiar with the Southern Plains organization, why don't you give us a quick capsule of what it is?
Yeah, sure thing. Well, good morning to everyone, and happy Earth Day to you, Gary. Do you know it's the 50th anniversary today?
Yes, it is. As a matter of fact, we had our coordinator up here from Environmental Services talk about what we won't be doing this year because of the epidemic we're dealing with. And
yeah.
Could be the weather might have a little something to do with it, too, but we haven't forgotten it.
Excellent. Well, yeah, well, again, thank you for having me. So my name is Nicholas Barton, go by Nick, and I'm the Executive Director of the Southern Plains Tribal Health Board, and we're located in Oklahoma City. Just a little bit of history, Southern Plains Tribal Health Board used to be known as the Oklahoma City Area Intertribal Health Board. We went through a rebranding campaign back in 2016. The organization itself was founded in 1972 by a group of tribal leaders. And many of our tribal leaders have continuously been included on the board of directors. We're a nonprofit 501c3 organization, again, based here in Oklahoma City. And a little bit about me, I am Cheyenne and Arapaho. I've been involved with the board since 2013 and had 15 years in tribal health. And so I come to the health board from Cheyenne Arapaho Tribes, former executive director of health, and was a resident of Clinton, staying here in Oklahoma City.
Well, that's quite a record. But anyway, forgive me for interrupting you there. Go ahead.
Oh, no problem. But what we do is help provide a unified voice on tribal public health needs and policy for tribal nations located in Kansas, Oklahoma, and Texas. So that area comprises what Indian Health Service calls the Oklahoma City area. So 43 tribes are represented. Our board membership, we have 12 board of directors, and that's an overlay of the 12 service units of the Indian Health Service. So again, we're a nonprofit. We've been supported by our tribal nations, but we are not IHS. So what we do is a lot of advocacy.
Well, that's wonderful. That's exactly what we need. Now, here's a question that's always kind of stuck in the back of my mind is Oklahoma and this region are really different from a lot of other places in Indian country. There are really no reservations to speak of as compared to Washington or South Dakota or, Minnesota. Do you think that might make a difference in the way problems and issues are tackled, and particularly the health issues here?
I would agree, and yes, we've always been just a little bit different. One, because of how we came to be. Many of the tribal nations were forced here, and we don't have reservations other than the Osage Reservation. That's Oklahoma specific. The 4 tribes in Kansas do have reservations. But again, here in Oklahoma, we have jurisdictions, and our tribal jurisdictions sometimes overlay with cities and towns. And so, for instance, Mvskoke Creek Nation, headquartered right there in Okmulgee. But we know that's Mvskoke Creek territory, but that's also part of Oklahoma. So, that's jurisdictional issues and boundaries here in Oklahoma create for a unique opportunity to help educate the other tribal nations in the area.
Yeah, and reminder, our council oak tree is in park in Tulsa, so we got to remind them from time to time.
Mm-hmm.
All right, now, looking at current events, everything you see, all the news headlines are around the coronavirus, and how it's been affecting Native America has not necessarily been at the forefront. But Native news organizations, of course, are dealing with that topic. Right now, we're seeing that the Navajo Nation is probably the hardest hit, and some of their numbers are way out in front of places even like New York. Do you see any situation like that developing here in Oklahoma? Has your organization had to deal with any input from tribes about something like that?
Well, that's it's been an interesting time. So, what we do here at Southern Plains Tribal Health Board is, one, again, advocate, and so we also do partnerships, advocacy, education, and training. So we also have what's called the Oklahoma Area Tribal Epidemiology Center. It's one of 12 epicenters established in 2005, and we work with our tribal nations, organizations, state agencies. And so this is, a good opportunity to help share, what we do. And so we've been actively involved with looking at, one, some numbers coming in, and I was just looking at some numbers, and if you don't mind, I'll share those here with our audience. So, in Oklahoma, there's 2,807 positive cases, and sadly, 164 deaths are attributed to coronavirus. And what we do know, coronavirus is a new coronavirus, and it's not been previously identified. And how they came up with the name COVID-19, just real generic, CO for corona, VI, virus, D, disease, and it started in 2019, of course, the end of the year. And what we know is that the virus spreads person to person, mainly through respiratory droplets, and it's produced when either an affected person coughs or sneezes. And so that droplet can land in the mouth or noses, and, we're even hearing the eyes, which is quite scary, and also can be inhaled into the lungs. And so that's how spread has been happening, going from person to person when they're in close contact. And we're seeing those rise in cases due to mainly increased laboratory testing and reporting, which is what many of our tribal nations, and especially the Mvskoke Creek Nation leadership, have been advocating for here lately. And so it's been said, it's a rapidly evolving situation. I mean, as numbers are reported in, we're still seeing this steady increase of numbers. And so that's the concerning part, but that's also due, again, to increased testing.
Well, that's always been a factor that's been included in many health-related issues. The more tests we do, the more numbers will show up, and that doesn't necessarily mean an epidemic is raging. It's just that we're getting more reports, right?
Exactly. And so if we can continue to do the good hygiene practices, washing our hands for 20 seconds, staying 6 feet away from one another the best we can, wiping down surfaces that we come into contact with, wearing cloth masks, the face masks that have been recently touted here lately, and a lot of good homemade masks are being made, and I've been on Facebook and seeing a lot of people with their masks on, and especially for me, I'm still in the office, but all I do is I come straight to the office from my apartment and then go straight back.
Mm-hmm,
so,
yeah.
You want to minimize your public access, if you will.
And while we're talking about numbers here, has there been anything of note here in Oklahoma that shows one tribe has been more affected than any others or something like that? As
of lately, I've had some of our epidemiologists look at how it's affected some of our areas, and so we've done an overlay, and I'm trying to pull that up here, but what we know right now is at least 206 identified American Indians and Alaska Natives in Oklahoma have tested positive, and that's out of that 2,807.
Oh, wow.
But of note, cumulative negative specimens are 41,537. So there's a lot more negatives, people not testing positive for coronavirus.
Mm-hmm.
So that's the flip side, and that's attributable to staying at home, those good hygiene practices.
The Mvskoke. Go ahead, please. Go ahead.
And so what we're seeing, of course, are in the two major metropolitan areas. Oklahoma County and Tulsa County have by far the highest numbers. And, of course, Tulsa County is just right north of Okmulgee County, and so that's in Mvskoke Creek jurisdiction. Seeing Wagoner has a high number, and that right now is that didn't tell me the number right there, so I apologize on that.
That's all right. No,
it's mainly in where you expect to see more people. That's where we're having more cases, and you get out to some of the rural and remote locations like Ellis County, Blaine County, Roger Mills out in western Oklahoma, Pushmataha and Cole County in southeastern Oklahoma, where not a lot of people are around. There's little to no instances of coronavirus just yet.
Yeah, just yet.
Mm-hmm.
Now, in the time that your agency has been working or concentrating on this particular issue, have any tribes come forward with programs that seem to be either innovative or particularly effective?
Well, our tribal nations that are Title V and even Title I contractors, so those operating their health clinics, we know this affected them majorly in several different ways. One had to do a new way of business. I don't know if you've been to the clinic lately, but you're starting to be screened before even entering the building. You've seen a lot more of our frontline professionals, what's called PPE'd up, personal protective equipment. So they have those gowns, the face masks, the goggles, gloves, and that's how they're interacting, keeping themselves safe and keeping the public safe as well. You've seen enhanced telemedicine, and telemedicine, it comes in a variety of different ways. A computer with a webcam, smartphones with cameras on them, and Apple FaceTime. I've heard of many clinics utilizing that screening, just so that way we can, one, still have access to the doctor. And then, you've heard of drive-through testing. Well, that's just been one way of, reducing that contact and, hoping to eliminate that spread. Mm-hmm. But what we've done is, you've heard of a lot of major infusion of money into by the government. And so there was a $40 million phase one funding that came down from CDC, and it was specifically geared to tribal nations. And so it was a multi-pronged approach. One came to the epicenter here, and we were able to send it out to our tribal nations. Also, those that are identified as Title I and Title V, that's just a way of saying how they're contracting with the federal government, either by self-determination or self-governance, and they were able to access funds from CDC. Some more funding came down, and this went directly to IHS, and it's a way to help alleviate the burden of getting PPE.
Yeah, we got a little surprise message there that wasn't supposed to be there. It's punching the wrong buttons at the wrong time. So welcome to live radio.
Excellent.
The Cherokee and I think the Creek nations have been in the news more often, I think, than some of the other tribes. Do you think that the message really has gotten out? And second part of the question is, what kinds of methods are tribes using when they get this money?
The message is getting out, and by and large, here the past at least 4 weeks, there have been numerous conference calls with the executive side of government, of the federal government. So we've heard a lot from the Native American liaison in the White House. We've heard from the recently installed IHS director, Admiral Michael Wiaki, and access to like the Department of the Interior, these high-level functionings. And many of our tribal leaders on the call, especially a lot from the Oklahoma City area, have been engaged in sharing and advocating and letting these people know at the top levels of government of what's going on at the local level. So that's been ongoing, and I guarantee you, many of our tribal leaders and elected officials have been on conference calls day in and day out. And for instance, there's a daily conference call with Oklahoma State Department of Health, and there's provided updated information to our tribal leaders, our tribal health executives, and other state agencies. But what we're seeing now is it's a slow uptick of kind of reopening government, because many of our tribal nations continue to be starting to furlough employees, and so they're operating not only on essential staff but critical, those that are critically needed. And so a lot of these grant writing opportunities are few and far between for tribal nations. However, I know that many are teleworking, as with much of our staff here. Only in office we have no more than 3 up to 4 people in office. The rest are teleworking, and that's kind of a new normal for right now. And so
it's amazing the way things have changed, though. Our office right today have 2. Yours truly here doing the radio thing, and my buddy Jared Moore doing the TV thing. And both of us have been concentrating very heavily on providing up-to-date coverage as we can. But this thing is just practically changing hourly, right?
And what I can appreciate is you doing your job to, one, help the rest of us, send that communication channel, and that's what's critically needed, quality information and sending it out. Again, we're seeing purchases of equipment. I know one tribe is looking at purchasing an automated prescription refiller, so that way they can allow the pharmacist to do other tasks.
Right.
If you've been to a convenience store lately, or shopping at your grocery store, a lot of this plexiglass has been recently installed, and so that's what some tribal nations are doing. I know one tribal nation is going to use that to alter their front desk area, because that's just where we're at right now.
Yeah. We've run across that a couple of times in different places. The effort here in our state would seem like it would almost be fragmented at first look with 39 tribes here. Has the money been reaching the places it is intended, where it needs the most help?
As far as I know, I would venture to say yes. I haven't heard of anyone say no just yet. But this money that has come down has been given a lot of flexibility. So, tribal nations do not like grants, because there's the sovereignty issue. We paid for this long time ago, land, blood, and everything else. And so this is just due compensation. And so when government wants to impose a grant-like structure, many of our tribal nations and our tribal advocators remind people, we need to have the flexibility. We need to do good with the funds here, and so we're just waiting on, what more we can do. And so right now it's just it's not really a stalemate or anything. It's just we're just kind of here, and so if people will shelter in place and help reduce that spread, I think it's going to do us well. What we've recently seen is private enterprise come to the aid of tribal nations, and so in the case of Walmart donating a lot of fresh produce, and I know they started in the eastern Oklahoma and went across to the west, and so that's been very beneficial to our tribal nations.
Right. So going back to the start of your statement there, if you take by government money, you got to play by government rules. Yeah. Has there been anything of note, a bright spot that you've noticed in your work and dealing with the tribes, with the perhaps solutions or activities or even intensity of their work and dealing with this?
I'd say the dedication of our tribal health programs to really want to make a difference, to offer assistance, and then just being told no in regards for their ultimate safety. I think if you ask anybody in a health and helping profession, they're going to want to help until they can no longer. And so sometimes it's incumbent upon the managers and leadership to institute safeguards for employee safety.
Right.
But that being said, I think there's still a lot of opportunity to showcase the resilience that natives have, and we've overcome worse, and for many of us this is a new world, first pandemic that we can see that it affected worldwide, and the repercussions of all of the actions here.
Right. Mr. Barton, we're going to have to wrap this up. Is there a final thought or a bit of advice you'd like to give to our listeners about dealing with this crisis?
Well, on the crisis itself, I just can't recommend enough. The best we can do is stay at home, even if the government wants to open against the good advice of public health professionals. Let's just do our part and stay home again. Practice those good hygiene, hand washing. Use whatever tools are available. If you need to see the doctor, see if they offer telemedicine, and advocate that way. But what I wanted to really run by the listeners was the State Question 802, the expansion of Medicaid in Oklahoma, and the importance of helping all Oklahomans with access to Medicaid, those that are struggling, who may be in a gap of not qualifying for Medicaid or Sooner Care in Oklahoma, and unable to afford health insurance. There's a vote that's just been called by the governor of Oklahoma, and that's scheduled for June 30th. Now, with that vote, there may be a risk of in-person voting, so whatever local counties voters are in, see about absentee ballot voting. But I just encourage everyone to check out State Question 802. It's very beneficial for Oklahomans, especially our American Indians and Alaska Natives here in Oklahoma. And more information can be found at okpolicy.org, yes on 802.org, or even especially our website, spthb.org.
Okay. Nicholas Barton, thank you so much for filling us in this morning on a statewide effort to help Native governments and citizens deal with the situation that faces all Americans, this COVID-19. So we want to say a couple of things here in my own language. Jenge Okosis is wash your hands. And Madoas, thank you.
All right. Hello from Cheyenne.
All right.
Thank you. Mm-hmm.
Okay, Nicholas Barton, the Executive Director of the Southern Plains Indian Health Consortium down south here. Stay with us. We're going to take a short pause here on the brew, and we'll be back and talk with Mr. Kyle Lee about what's happening with the festival. So stay with us, please.
just like my big brother. And some of my friends were already doing it. We got hooked fast. I just can't get enough. I'm Jacob, and I'm addicted to playing the drums.
There's lots of stuff that makes it cool to be Native. Doing meth isn't one of them. Find something better to do. Check out ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Hear that? That's the sound of hope being killed by meth. Methamphetamine use is causing huge problems in our community. Hear that? That's the sound of something you can do about it. Events like rodeo, res ball, and family time can help keep kids away from meth.
Talk to your kids. Keep our culture alive. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Learn more at ncai.org.
Who am I? Am I Indian? Just 'cause I'm a girl from the res, don't make things up about me. What if I move away? Then who am I? Some kids try meth just to escape, but then I think about my grandma, my little brother, my beadwork, my poetry, and I think, I like who I am, and I know meth is not for me.
Check out ncai.org, a message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Welcome back to Mvskoke Radio here on the Brew. We have Kyle Lee on the line here with Tourism and Recreation from Mvskoke Creek Nation. And boy, have you got a whopper of some news for us.
Hey, Gary, thanks for having me on this morning.
Anyway, you say it. I don't want to.
Yeah, as you might have saw last week, we made the really difficult decision to postpone this year's annual Mvskoke Nation Festival. It was a tough choice, something we hated to do, but we want to at least, get that news out there to everyone as early as possible because a lot of people base travel on that and kind of plan some of their summer around it. So, that's kind of the big news for now, and we're just going to kind of keep an eye on the situation, and see what potentially new dates could look like if we try to reschedule again for later this year.
Well, let's hope. Now, a decision like this, as we both have been saying, is tremendous. It's got to take a lot of examination and this kind of thing. Tell me what in those discussions, what were the factors that kind of made you all come to this conclusion?
I mean, first and foremost is the health of everyone and safety. When we have the festival, we usually have attendance, we guess around 40 to 50,000 people. And with the way that, the virus is right now, that's just kind of a scary thought to put that many people together so soon without really knowing, what things are going to be like in 2 months. And so, just thinking about, kids riding rides and people, gathered for concerts and just, playing sports, there's a lot of potential contact and interaction, and we want to make sure we keep our citizens and just the general public safe, and we think it's our part to protect everyone, and at least now we have some time to kind of see what happens and plan better too. Part of that also is trying to plan and not really knowing what we're planning for, and now we have a little bit more flexibility to make good decisions, and also another part of that is just seeing, from a budgetary standpoint, if we have to look at, potentially, maybe spending a little bit less money, we can do that now. So it just gives us a lot more flexibility and ensures that we're keeping everyone safe.
Well, that health factor is just so critical there. I mean, you go to that festival and you're shaking hands and hugging everybody, and then vendors are, dealing back and forth with their merchandise, and then, of course, the food folks are there. I know they usually have practiced, hygienic conditions, but it's got, it's so much more than that. It's like we breathe on each other and laugh and joke and all kinds of things. Wow. Does this monetarily, has anyone discussed what this decision means?
No, that's not been in discussion yet. the festival is a special appropriation by the council that's annual, and so we've got that full budget for this year, and as far as I know, that we'll be allowed to use that, and unless directed otherwise. And so, but part of the festival too is it grows every year, and we try to add on new events, and a lot of that we're able to do because of sponsorships to help us fund some of those, and really not interested in asking anyone for assistance with sponsorships right now with all the businesses being shut down. And so that's one thing that we want to be considerate about is when we do it, being able to handle it ourselves without having to look for any sponsorships, because everyone needs to take care of themselves right now, and we want to be good partners to our community and local businesses and organizations with that aspect in mind.
Have you had any feedback other than the anguished cries of pain heard across the country? A lot of vendors, I would presume, look at this as a key to their economic calendar. And, of course, without that, festival, there are the 3 days of merchandising.
Sure.
It's got to be, a major hit on them. Has anybody spoken up yet? I know it's early in the process, but have you heard anything out there?
Yeah, I was curious what the response would be, and because I know a lot of people look forward to the festival, and like you said, a lot of vendors will kind of rely on that. But I've been really amazed and excited to see the positive response we've got, and everyone just being thankful that we're looking out for everyone's best interest and health and safety in mind, and really not have any kind of negative, comments at all that I've seen or heard. And a lot of people just, saying, let us know if it happens, let us know when it's going to be and count us in. And so I think people are really understanding. And, if we potentially do end up having to do something in the fall, then, people might be excited. The weather might be a little bit cooler. So, there could be some positive from that too, and so I think so far the decision has gone, publicly as well as it could have gone so far.
Well, there goes my 3 days of Indian tacos. The festival is always looked at as a high point of the social year for the tribe, and without it, it's going to be long winter. A long summer. Now, you mentioned a possible postponement, perhaps something in the fall. I would guess that the festival would have to be somewhat more customized to fit the date and weather and the occasion, right?
Yeah, I mean, we haven't talked about any specific dates or anything yet. We'd like to still have one this year. I don't know when it'd be if we do, but I assume if it has to be a later date, that the fall is the most likely scenario, and just trying to find dates that might work then. And like you said, it probably wouldn't be I guess laid out as traditionally as it typically is, but we'd still try to do as much close to normal as we can, and just try to be creative with the planning with that. And as soon as we know more and as things develop, we definitely will let the public know as quick as we can, because we know everyone's interested to see what the plans will be.
Oh yeah, it's such a great time. A lot of family reunions going on there. Folks you haven't seen. I've run across a couple I haven't seen since college, and that's Fred Flintstone days. Now the final question I really had was again related to that. Of course, the economics are important. The way Okmulgee sort of rearranges itself because of things like the parade and all of the traditional activities and things like that. So as we look at this, would we see a kind of perhaps a more condensed version of the festival if it were to be postponed till the fall?
It's really too early to tell right now. I'm not really sure what that would entail if we did another version. Like I said, I think we'd try to do as much as we could for for the traditional festival. It just depends on when it would be and what everyone's availability would be, honestly. So it's a little too early to tell for that. Hopefully it looks just like it does every year, but as of right now, not knowing when and if everything will happen, it's kind of hard to say.
Okay, well, I tell you what, we will be watching this one closely, so if you get any more information to share, let us know. We'll be more than happy to put it out there for you and give you guys
Great, thank you for that. Yeah, we'll let you know as soon as we can, and hopefully everyone's staying safe, and we can't wait to get back to work on it. And, we'd already been working on it for several months, and so it's kind of a bummer to put everything to a stop, but we'll be ready to get back on it as soon as we can.
Okay. Oh, one thing I did want to ask you is, prolonging this interview, is that the time of year, I guess, would affect the kinds of talent that you're able to book for the highlights there?
For the entertainment?
Yeah.
Yeah, and if we do it in the fall, I mean, it actually could be better for us, maybe. I mean, because, a lot of bands book for summer tours, and so, if it is later in the year, maybe their schedule opens up to give us, more flexibility. But we're hoping the acts that we were planning to work with for the summer will still be available. We're excited about, kind of that direction we were going in. And so, but yeah, I guess you never know, because, every band schedule is different. And I know some artists are canceling their shows for the entire year at this point. And so we're living in an unknown world that's different than we've ever seen. So, well,
let's hope that it doesn't prolong itself too much longer, that people can return to a more normal or routine way of life. Kyle, thank you so much. We appreciate you taking a few minutes here this morning to fill us in, and we'll be here in case you need something. Let us know. We'd be delighted to try and spread the word for you.
Thanks so much, Gary. We appreciate the time today, and you have a good one.
You too. Okay, Kyle Lee with the Tourism and Recreation Department. He is filling us in on why and I guess why the festival is postponed this year. And I like the word postponed rather than canceled. So let's hope for the best. We'll take another short pause here and try to get our next guest, our reporter Angel Ellis, on the horn and find out some of the information to try best for the COVID-19 testing. So please stay with us here on The Brew.
Who am I? Am I native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Okay, we're back here on The Brew, and I just looked out the window, and boy, it's starting to get dark here, so folks be aware of the weather and take precaution. Angel, you there?
I'm here, Gary. Thanks for having me on.
Okay, we have Angel Ellis, one of our reporter staff for Mvskoke Media, on the line. Are you on a speakerphone by any chance?
I'm not on the speakerphone. Would that help or hurt?
No, it would. We always got a better sound signal on a landline, but we'll take what we can get. We have all been kind of commanded by news, both federal, state, county, city, on the COVID virus and how people are dealing with it and how our communities are responding. Now, I understand there's some late information that you've acquired that would give some people some ideas of where they might get checked out to see if they are being affected by the COVID-19.
Sure. I have spent the last 2 weeks just kind of buried in the Oklahoma State Department of Health website looking at the data and numbers that they're reporting out. And about a week ago, they reported different drive-through testing sites that people could go to find out, if they have symptoms. They can make these appointments. Most of the state health departments are testing, and they're testing either by appointment. They want you to call ahead, and so you can always go there and get a test for free. And then the Mvskoke Creek Nation's facilities are testing, and we just found out about maybe 3 or 4 days ago that the Mvskoke Creek Nation's health facilities now has access to a 15-minute response test. So people don't have to wait as long when they're looking to get those results to find out if they have the coronavirus, if they are, contagious and could be spreading it. They can get rapid results, and that way they can make the decisions on staying safe and healthy and keeping others safe and healthy.
Well, go ahead.
Those are some really good developments. Early on, we were kind of hearing about, these cases popping up, and people were like, okay, well, what do we do? Where do we go to get tested? So now we have, if you go to the Oklahoma State Health Department's website, you can see a list of all of the health departments in the state by county. So wherever you're located, you can find that health department nearest you. For people listening in Okmulgee, the health department is located at 1304 Road Miller Drive in Okmulgee, and they're doing tests from 9 to 1 by appointment. You need to call ahead. And a number for calling in Okmulgee is 918-756-1883. And I think that most of the places that you might go, whether it's a tribal health facility or a state health department, would like people to call ahead. That way they can make the preparations and keep, whoever is possibly infected kind of in an isolated area. That's trying to do like the containment, kind of processing of folks who are looking for testing. So we also have seen that anybody wanting to just kind of figure out how many people in their communities have been affected, now the state is beginning to break down the data a little differently than it did in the beginning. I think that in the beginning when we were watching the data and stats come out, it was kind of a scramble to keep up, but it looks like they've really refined the processes, and now their website for the state is reporting by county and by city and by zip code. So you can really find out how many people in your community, are getting sick or recovering. They're reporting the recovery numbers now too, which is pretty important. I think that as we've watched the COVID-19 coverage come out, some of the numbers look pretty daunting, and you see, so many cases of positive infection, and then you see how many people have, succumbed to this infection, and that can be pretty scary. But now they're also reporting recovery numbers. Right now, I'm just looking at the website now as I'm kind of talking with you, and so as of yesterday, there are 2,807 cases in Oklahoma, and that is up about 127. That's about 4.7%. And the number of deaths is 164. That was up 21 people from the day before. So that's 21 people in 24 hours. And that rate is at 14.7% right now. And the recovery rate, which is kind of the one that's a little bit scary, at least if you're looking at it in terms of, how quickly you can recover after you've gotten sick, recovery rate is 5.5% for Oklahoma. So right now, 1,702 people have recovered. That is 88 people up from the day before. But it takes a while. Like when people are sick with this virus particularly, we're used to kind of that, you stay home a few days and your fever goes away. This one's more of a prolonged exposure, I guess, or a prolonged period where you have the virus and you can give it to other people. And that's kind of what seems to make it such a wild card when you talk about, keeping that infection contained or that virus contained. So people can be walking around with it a lot longer than you really think. And the way that they determine you no longer have it is you have to test twice with a negative test to determine that you've fully recovered. So you're looking at like almost a month overall that you could potentially be, carrying symptoms or, giving them to someone else. That's kind of that X factor, in my opinion anyway, when people are talking about wellness and everything.
Excuse me, now, have any of these reports gotten any more specific? Of course, we're all concerned about the Mvskoke citizens and how our health department is responding. But do you have any breakdowns there, either in recoveries or fatalities?
I don't have the breakdown of numbers of people who are strictly seen through Mvskoke Creek Nation facilities. That's not available to me. But what I have been able to do, because the state's website reports by city and county, I'm able to produce a little chart of my own, just tracking the counties that exist within the Mvskoke Creek Nation's boundaries. So what I'm able to do is say, I have a number each day that comes out saying that this number of people have the virus in the Mvskoke Creek Nation's boundaries, and this number of people have, passed away from this infection in the Mvskoke Creek Nation boundaries. But what I cannot tell you is how many of those people are actually Mvskoke Creek citizens, because it doesn't break it down by tribe. Newest data coming out by the state is reporting demographics such as age and race, but that's for the state overall. So I don't have anything specifically in the 11 counties that are Mvskoke Creek jurisdiction that breaks it down by age and race. So I can't say, when I'm putting up these charts on our media websites and our social media, and it shows Creek County, Hughes County, Mays County, McIntosh, Mvskoke, Okmulgee, Rogers, Seminole, Tulsa, and Wagner. But I can't tell you for sure that all those people are Creek citizens or not. They may be non-native, they may be, multiple races, they may be, it's just the citizens who live in this area. But I think the beneficial aspect of that is knowing that, say, if you live in Okmulgee County, right now in Okmulgee County, you can look on the state's website and find out how many cases of coronavirus there are in Okmulgee County, for instance. So I'm pulling it up now, and it can show you how many cases were confirmed. For Okmulgee County, there are, as of yesterday, 15. No one in Okmulgee County has been reported to have passed away from COVID-19. There are 0 deaths associated in this county, and there are 13 people recovered. That's what data I'm able to pull from the website, from the state. And it tells me that in Okmulgee County, there are at least 2 people who have COVID-19 and are still active. And that can kind of help people gauge, the climate of how this infectious disease is carried out in their counties. And it can even be broken down by town.
Wow, that's quite a load of information, and I'm hoping at some point that someone would be able to provide more detailed analysis, like age groups, perhaps, if there is.
There are some data on age. I have a chart here. It's showing that, but it's for the entire state. And so when you're looking at the data, Oklahoma total cases by age group, the biggest age group affected is 65 and over. There are 908 cases in the state of Oklahoma right now that are age 65 and up. And then the next biggest age group is the 50 to 64. That's at 24%. And that is 691 individuals, The next biggest age group would be age 36 to 49. There are 586 of those cases. And then surprisingly, and this kind of blew my mind a little bit, age 18 to 35 is the 4th largest, and there are 538 people age 18 to 49 who can contract the virus. So they do have a pretty good breakdown on age, gender, and I think the reporting on race and ethnicity, that came a little later. We didn't start seeing that until about a week ago, so I'm wondering if they just had a backlog of data, and I think that they actually did report around the 14th or 15th, they had a backlog of data that they uploaded. So for a little bit, their website was kind of hard to navigate, and I think it was because they were putting in all this new data and putting it into charts and things that are easily to digest for people out there wanting to know the situation.
Well, before we go any further, let me say thank you to yourself for translating and digesting this data to this point for us, and now it makes a little more sense and more information. As we watch our tribal health department respond, is there any information there on how they're doing? Do they have the necessary supplies, a number of beds, staff and personnel? Any of that come to the surface yet?
Well, I think that our health systems are included in part of the data, especially in our area where the Mvskoke Creek Nation hospitals are community hospitals. One of the cool things going on with the state's data is that they juxtapose these cases of COVID-19 infection with a report that also shows the number of available hospitals. So what you can, I don't have somebody necessarily at the Mvskoke Creek Nation's Health Department shooting me numbers daily, but I can go and I can see that in my county there are X amount of hospital beds, and so far in the Mvskoke Creek Nation's jurisdiction, it seems to be that when you break out that by county, because that's the only way to break it out, you can't really determine if it's tribal or a regular hospital like, say, St. Francis or something, but you can see how many hospital beds there are, and it's kind of looking to me, and I'm not a statistician or a health professional, but it looks to me that for, the 11 counties that Mvskoke Creek Nation is kind of operating in, that social distancing could be helping. We haven't seen any reports where we've been bombarded with cases in the sense that, there's no beds. So it's kind of like people are doing a good job or continue to stay home and keep doing that good job of, keeping that social distancing so that we don't have an instance where somebody has to go to a hospital but can't get in because you just don't want doctors to be in the position where they're deciding, how to help and who to help. You know what I mean?
Right, yeah. Today's radio program is practice in social distancing. Mm-hmm. All of our interviews have been by phone.
Yeah, and that's been one of the tickets, I think, that has helped. I know that on the national scene, we're looking at, people on the national level considering reopening. You hear a lot of talk about the economy, but I think that one of the coolest things about being a tribal citizen, and this is one of the things I love about us so much, is that we look at our community members and our people's health as paramount to all these decisions. And I don't think that we've ever had any instance where they're talking about, we can't afford to be at home anymore. That's kind of I see that many of the tribes have handled this from that, human health and human wellness perspective, and the economic factors have kind of, been like, we'll work that out. But it's great and encouraging to be a Mvskoke Creek person at this time, because I've seen the tribe just do all kinds of things, and everything that they're doing is completely new and different and unprecedented, but they're making it work and getting the job done. So that's really encouraging. I haven't heard any reports that we're coming low on health equipment. That hasn't been mentioned. I talked with the press secretary yesterday and got good reports from him, and so it looks like we're in decent shape. Conversations are happening about like when and how to reopen, and at what things need to take place before they do that. And it looks to me like the administration is taking a real consideration of the need. I know that yesterday Jason Salzman, he is Secretary of the Nation's Press Secretary, he said that one of the departments that was kind of struggling with the low staff was the tag agency. And so they've kind of put some precautions in place, put up some barriers between the customer and the worker, and they've fine-tuned the process and added a few more workers back to help get that taken care of. And I think that that's how they're going to kind of address things. They're going to examine, the needs on the ground and then see what they need to do from there to keep everybody safe and healthy. It's looking pretty encouraging from that point. Jason reported a lot of good things, so I think we just kind of watch and wait and keep an eye on these numbers. The national advisory is coming down to be like, it's going to be the governors making these decisions to reopen. From what I heard the president say, he was saying that it would be left to the individual state governors to lift the emergencies or whatever orders are in place, and that those kind of orders could come after a 2-week period of decline in COVID-19 numbers. Now, for Oklahoma, that might be a little ways off, because our numbers are still climbing, so we can kind of expect to just do lots of close monitoring and taking things day by day is what I'm kind of gathering.
Wow, that's a lot to cover. I mean, to keep up with it now.
Yeah, I never thought in my career that I would become a virus reporter. That's kind of the way it's gone.
A virologist or something. Now, this is hearing you share all this information as a reporter, and you get this kinds of thing. It's got to have some kind of effect on you. Are you worn out? Are you kind of sick of it? No pun intended, but.
I am looking forward to the day when this is all in the past and we talk about it like that weird thing that happened. I'm hoping, I did get about 2 weeks into reporting numbers. And then I saw the headlines from like Navajo Nation, and it really does get to you in the sense that, man, it really can be stressful. And then like the first time I had to go out and actually go to the grocery store after being I've been in the house with the family, and, I'm reporting these numbers, but I'm looking at it through a lens of I'm the reporter and this is just facts, and I'm just transferring them from the source to the audience. But then the first time I went out to actually go get a few groceries and some more toilet paper, I was kind of in a little bit of an anxiety attack moment for me. I was like, some of these people are just walking around with their kids and they're, and you kind of get like a lot of anxiety about it. You see people, I'm more hyper aware of people touching their face, touching a thing on the shelf than I've ever been in my life. It's kind of a weird situation to be in, to be honest.
Right, to go to a grocery store and see the shelves clear where there used to be paper products.
Yeah, it really is. And like, I know that for me, you're always kind of, when you're working, it's easier, but then when you step back and relax for the day and just digest everything you've done, it's kind of like, wow, I've never seen anything like it. And,
yeah. Okay.
And you wonder, like, what the recovery is going to be like. It probably will be a long process, to be honest.
Right. Well, we're going to have to run here. We're out of time. Thank you for being available to chat with me this morning, kind of fill us in.
Sure.
And we'll be talking with you later on during the week to keep abreast of what's happening. So,
all right. You stay healthy.
Okay.
Bye.
Thanks for listening to Mvskoke Radio here on The Brew. We want to say thank you. We'll be back here again next week with some more information. So please stay with us and return to The Brew. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. But